Hi, my name is Danielle and I'm going to be your nurse today. Can you tell me your name and date of birth?
Yeah.
Yeah. Oh, thank you. I'll check your wristband.
No.
And check for name and date of birth. So I heard you were recently put on a Lovenox injection. Is this right?
Yeah.
Yeah? And I'm here to teach you about it, okay?
Okay.
Okay. Do you have any allergies? Do you have any allergies? No? And are you currently on any medication? No? Okay. So I want to make sure I note the allergies and medication in the patient's documents and check. I'm going to wash my hands, provide privacy, and check that MAR. Are you ready to learn about your Lovenox injection?
Yeah.
Yeah?
Yeah.
Okay. For this patient teaching, I made a flyer to show what to assess for before giving the injection, during the injection, and after the injection. Before giving your injection, you want to assess for bleeding, observe the injection site, assess for evidence of additional or increased thrombosis, assess their neurological status frequently. During injection, you want to make sure you do not aspirate or massage after giving the injection. You want to make sure that the injection solution should be clear or colorless, possibly slightly yellow, and administered deep into the subcutaneous tissue. After injection, you want to assess for side effects, assess for bleeding, and dispose of the needle properly. Common side effects are bleeding, anemia, dizziness, headaches, insomnia, fever, or constipation. This is how you keep yourself and your loved ones safe when using Lovenox. Hello, and welcome to Learning About Lovenox. Today, you'll be learning all about your new anticoagulant. What is Lovenox? Enoxaparin, also known as Lovenox, is a type of heparin, more specifically, a low molecular weight heparin. Low molecular weight heparins are the most bioavailable fraction of heparins. Bioavailable means the ability of a drug or other substance to be absorbed or used by the body. These heparins have a more precise and predictable anticoagulant effect. How does Lovenox work? Lovenox works by the inhibitor effect of antithrombin and factor 10A in thrombin. This leads to the prevention of thrombus formation. The indications for the use of Lovenox is prevention of venous thromboembolisms, deep vein thrombosis, also known as DVT, or pulmonary embolisms. Clients expected to be seen using Lovenox are patients who have undergone abdominal surgery, patients who undergo a hip replacement, knee replacement, or clients who are at risk for thromboembolism complications due to severely restricted mobility during acute illnesses. We know that Lovenox is a type of heparin, so now let's learn a little bit more about heparins. How does heparin work? Heparin is an indirect thrombin inhibitor which will enhance activity of antithrombin 3, inhibit thrombin, thus stopping the conversion of fibrogen to fibrin. Remember, heparin does not break or destroy clots. Now, let's learn how to use Lovenox. I'll be teaching you the expected side effects, how to administer the medication, and expected dosages for Lovenox. Lovenox doses. VTE stands for venous thromboembolism. Patients undergoing a knee replacement surgery will receive 30 milligrams every 12 hours, starting 12 to 24 hours post-op for 7 to 10 days. Patient undergoing a hip replacement surgery will receive 30 milligrams every 12 hours, starting 12 to 24 hours post-op, or 40 milligrams once daily, starting 12 hours before the surgery. Both doses may be continued for 7 to 14 days. VTE prophylaxis following abdominal surgery. Patient will receive 40 milligrams once daily, starting 2 hours before surgery, then continued 7 to 12 days until ambulation, up to 14 days. Patients with medical acute illnesses that keep them immobile will receive 40 milligrams once daily for 6 to 14 days. Remember, these are just recommended doses. Your physician will prescribe the best dosage for you. Lovenox is typically available in pre-filled syringes or multi-vial doses. For this example, I'll be teaching you how to administer the pre-filled syringes. First, let's gather our supplies. Things you will need: the pre-filled syringe, alcohol wipes, and a sharps container. If you do not have a sharps container at home, an old washed out milk jug or detergent bottle will work just fine. These are the parts of a syringe. You have the needle, the hub, the barrel, and the plunger. When administering your medication, do not touch the neck of the plunger. Make sure you use the head and push down slowly. Your Lovenox injection will already be pre-filled, so you do not need to worry about filling your syringe with medication. Reducing discomfort with subcutaneous injections. Insert the needle with a dart-like motion without hesitation. Remove it quickly at the same angle at which it was inserted. Inject the solution slowly so that it may be dispersed more easily in the surrounding tissue. About 10 seconds per milliliter. Rotate injection sites to reduce irritation. Selecting your injection site. We will be giving the injection in the abdomen. In the abdomen in the umbilical region, about 2 inches to the left or right from the belly button. For our injection, we will be using the abdomen. 2 inches to the left or right from the belly button. In the umbilical region, this is where we will be giving our injection. Before going into the steps of giving a Lovenox injection, I want to show you how to pinch the skin of the abdominal region so that way you grab just the fat and not grabbing muscle. So make sure that when, on your abdominal region, you don't just want to pinch up and grab 2 inches. You want to use your pointer finger and your thumb and pinch 2 inches. So that way you're just getting the fat. You want to take your injection at the same time each day and make sure the location of the injection is free of scarring, cuts, or infection. Steps to giving your Lovenox injection. Wash your hands. Clean the area with an alcohol wipe in circular motion. Uncap syringe and make sure not to bend the needle. There will be an air bubble in your pre-filled syringe. Do not squirt the air bubble out. With your free hand, pinch with pointer finger and thumb to ensure that just the fat is pinched off 2 inches of skin. Insert the needle and remember, use a 90-degree angle with a darting motion. Slowly press on the plunger to inject the medication, including the air bubble, and pull the needle straight out. If your needle has a safety guard, make sure to use it and then dispose of your needle in the sharps container. Now we will be talking about patient and family teachings. It is important for family and patient to recognize the side effects and caution signs with Lovenox. Advise patient to report any symptoms of unusual bleeding, bruising, dizziness, itching, rash, fever, swelling, or difficulty breathing. Know the signs of bleeding, such as bleeding in the gums, nosebleeds, or black tarry stool or unusual bruising. Instruct patient not to take aspirin or NSAIDs without consulting their healthcare provider while on therapy. Advise healthcare provider if patient is pregnant, planning on becoming pregnant, or breastfeeding. Remember, with Lovenox, our desired outcome is prevention or resolution of DVT and pulmonary embolism.